Welcome back to Renergy. This is Dr. Carolyn Bowers, your doctor of physical therapy. Hey, guys, it's been about 3 weeks since I did an episode, and I am sorry I wasn't able to be on, but I've been pretty darn busy, and I'm really excited to talk to you about what's been going on. So let's get started. I remember the last episode that we talked about discussing duality. So I want to discuss that with you. Duality when it comes to working with your patients on a regular basis in your clinics or in the hospital setting. One thing that as therapists that we always have to remember is that our patients are more than just a physical being. There is a energetic aspect to them. There is a spiritual aspect to them as well. And there's an electrical aspect to them as well. So when we talk about duality, we really want to consider the fact that we are looking at a person in their physical form, but there is also the other side of the person that must be considered, and that really is that energetic form of that patient. And this is where Renergy comes into play when we start working with our patients and trying to facilitate the best outcome for them. So I'm going to share with you another patient scenario just to kind of show you how that looks inside of a patient's room or inside of your clinic when you're working with a patient. Many of the patient scenarios that you will hear on my podcasts and the different episodes are in my book, Sacred Rehab. That is in the process of being completed and will be made available, and I will notify you on the podcast as soon as it is. All right, let's begin. I entered the room to find the trauma physician speaking with the patient about her injury to her left hip. The patient is complaining because she believes that she's had a TIA the night before. A TIA, for those that don't know, is a transient ischemic attack, which is a form of a stroke, but doesn't have any long-term physical effect. The physician turned to me and confirmed no signs were noted physically by the nursing staff of her having a TIA, but the medical staff agreed to further address the patient's concern. The patient has a history of traumatic brain injury and has had multiple traumatic events prior to her current left hip fracture, which had left her with what we would call in the PT world touchdown weight bearing on this left lower extremity with some posterior hip precautions. So her score normally, when we ask patients their pain level, which is a 0 out of 10, she gave a scale of 6 out of 10, which would limit some of her mobility. She agreed to mobilize with PT, but was moving very slowly and required extra time to prepare. And then she was able to move. Her movement was very disjointed and asynchronized. I asked her if she would be willing to count backwards from 5, and she agreed. Now let me pause there for a minute. One of the things that I use with the clients when I'm working with them is I will use reverse counting. The reason I use reverse counting is to help synchronize the prefrontal cortex, which is where our conscious effort takes place, with their physical body, so that when they begin to move, they can synchronize the movement. The nervous system will then come in to support them versus guard them against movement. And they all look at me a little crazy because most patients and family members, when they're working with their family members, they count 1, 2, 3, go mom, okay, move, okay, stand. Unfortunately, when I go 1, 2, 3, 4, 5, after you have had a physical trauma, counting forward does not help the brain or the prefrontal cortex, the conscious effort in your brain to help you to move or synchronize your movement again. As a matter of fact, it might even confuse the nervous system a little bit because the brain doesn't know when you're going to go. When you say 1, 2, 3 and start counting up, the brain doesn't know exactly. Are you going to go at 99? Are you going to go at 5? Are you going to go at 4? What I have done and have seen great results is I have done the reverse counting. Now, I'll tell you a little story about how I came across reverse counting or to use reverse counting. And that was from the author Mel Robbins. Mel Robbins talks about the use of 5, 4, 3, 2, 1. I think she's called it the 5-second rule. She uses it to help people learn how to get things done that they've been procrastinating with moving forward. So I began to use the 5, 4, 3, 2, 1 with my patients. And the reason why I had used it with my patients is there was research by A. Bicara entitled Emotion, Decision Making, and the Orbital Frontal Cortex. This research showed that the conscious effort in the brain is found in the prefrontal cortex. So I'm thinking Mel Robbins is using it to help people to not procrastinate. And I started to think, well, if I have patients and they're struggling, I need to help them to put this effort into the prefrontal cortex where it is a conscious effort. And I began to use the reverse counting, and it helped to place it in the prefrontal cortex, just as Mel Robbins had said it would do for people who procrastinate, to help them stop procrastinating. So now what I would do is I would ask the patient to do a task. And so subconsciously, they will be thinking about the task in which they are trying to do, which is to come to the edge of bed, to perform a sit to stand, to take a step. But we would use the reverse counting of 5, 4, 3, 2, 1. And after we would say 1, we would then initiate the task. And 99 to 100% of the time, the patient was able to now achieve the task in which they did not believe they were able to do, just by subconsciously telling their nervous system what it was they desired to do, and then using the reverse count to tell them when it wanted to do it. Often I tell my patients, you're like my rocket. We're going to go to Houston, and what do they do in Houston? They go 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, blast off. So we do the same with the 5, 4, 3, 2, 1. The nervous system and the body is going to be on the same page, looking for the exact same thing at the exact same time. So we bring about synchronicity with the conscious effort and the functional mobility or movement task. So this is exactly what I ask of my patient. I ask her if she would be willing to count backwards from 5 after subconsciously telling herself what it was she desired to do. We were going to stand and we were going to take a walk over to the chair in the room. And she gladly agreed. And once she did, she realized how much easier it was for her. And she even stated, oh my goodness, I can actually walk better. The results that you will see when you use this reverse count with your patient, it synchronizes them almost immediately. You may sometimes have to repeat it a few times for them to get the hang of it and get comfortable with the count. But once they do, they can take that and use that anytime with or without me beside them. And that's the thing that makes it unique, because the patient can take it and use it for themselves and get the same result. So back to my patient. She continued to use the 5-second rule. At that point, she was hooked. She began to use it to mobilize independently with the rolling walker inside of her room, and to perform sit to stand from the chair. This patient happened to be a homeless patient and had an opportunity to transition to a shelter because she was able to ambulate independently with home health to assist with increasing her gait distance. After returning to her bed, she stated she always wanted to experience acupuncture and energy work. So I then introduced her to tuning forks, and I was able to use tuning forks audibly around her. Because within the hospital setting and within patient care, there are precautions that have to be taken when using tuning forks. In particular, placing tuning forks on the body when there is a recent acute injury that possibly could have a fracture, or they've recently had a repair surgically, that you don't want the tuning forks on the body that might vibrate and cause a loosening of the screws. that have been placed into the body. So I use the tuning fork 174 hertz and 528 hertz to facilitate a relaxation and continue to increase the parasympathetic response, because she was having such a positive response to it, and she really was wanting to experience what it felt like. Decided to get into the temporary housing and try to get back to her life again. She shared she's also wanting to write a book, and was looking forward to getting back to finish her book. We are finding every day that our patients are more open to the duality of being in the physical body, but also addressing their energetic aspects of their body as well. And as clinicians moving forward in the future, we are going to have to recognize that there is more to our patients than just the physical body in which we are seeing in front of us. There's an aspect of them energetically that we do need to address, and we need to offer them things that can help them energetically to balance their body, to help them bring balance physically, to bring balance energetically, and even bring balance within the electrical system, within the nervous system that runs throughout our body. Renergy absolutely helps open and motivate patients to set new intentions for their future. And that is something that I've seen consistently when I work with patients, that they are always open, and the conversation shifts away from the impairment. It shifts away from how hard things have been for them, and they start thinking and talking more about what they're looking forward to. Okay, everyone, it's tea time. Go ahead and grab you a glass of wine or a cup of tea and put your feet up on the sofa. Or if you're headed in to see your patients in the hospital setting, the private setting, or in the home, get ready, because we're going to talk about intention. And you say, well, what does intention have to do with rehab or energetic work? Everything. You cannot do it without it. And if you've been practicing and treating patients without intention set for you and for the patient to set their intentions, we have missed the mark as therapists. So let me give you a little nugget. Whenever I go in to see my patients, one of the first things that I ask them is, what is your intention for my session or for our PT session? What do you desire to get out of this session? And then I listen. And then I observe. And I watch very closely how their actions are telling me a lot about what's going on with them energetically. So as the patient is talking to me about what their intentions are for our session, I am watching them very closely. I am observing everything they're doing. Everything from the tilt of their head, if it leans to the left, if it leans to the right, if one shoulder's elevated, one is depressed, one is lower than the other side. I'm looking to see if the pelvis is rotated one direction over another. I'm even looking to see, are we crossing our legs at the ankle, legs very close together and tight? Are our knees bent? Is one right leg pulling higher than the left? If one right knee bent and the other one is straight? Because all of these things are observations, but they're also telling me a lot about the patient and where their pain is, where their comfort level is, where their discomfort is. So I now am able to listen to what their intention is, but when I begin to go in to work with them, I am allowing the body to speak to me because I'm observing exactly what it's doing. Then I am ready to look at them and take that observation and give them the support that they need. And this is where Renergy comes in, because Renergy is what is really helping me to be able to observe accurately and then see where their energy is low, their energy is high, where their tension is, where their resistance is, and with intention, I am saying to myself, how can I support this patient? What is the best way for me to support them? Because I see them physically, but I know that every move or every tension that there is or pain that there is, in most situations, there's something underlying that. Even after surgery, I do honestly believe, and I've said this in the very beginning, that if you're in our hospital or you're having to get therapy, you have been traumatized in some form that is now requiring you to go and get help. Someone to support you is what you're looking for, to support you regaining your function, regaining your strength, regaining your mobility. So as therapists, this is something that we should be honored to be able to do, but it does take us some time to train to be able to observe accurately. And there are things that I will share with you that I have been learning because over the past 3 weeks when I wasn't on the podcast, I was finishing up my biofield tuning provider certification. And that has taught me so much. So I'll have a whole segment on that as we continue with the podcast, and I look forward to sharing with you at the appropriate time. But just remember, I encourage you that when you go in to see your patients this week, start off that way with them and ask them, so what's your intention? What do you desire to get out of this session with me? So that our session can be focused. And then another little tidbit I'll give you, and something that I often will say when I go into my patients' rooms and I'm working with them, I often say in my head to myself, I'm speaking this, that as this patient heals, so does the world heal. I heard that from one of my biofield practitioner, trainer, instructors, and she used that, and it's really spoken to me quite deeply. And so I've begun to use that when I go in and I'm working with my patients, because I truly do believe that as we help our patients to heal, we help heal the world, because now we have people going out from our clinics and our practices and out from under our physical therapy care, and their mindsets have shifted. Their intentions are purposeful. They're working within their conscious efforts. They are present. They are focused. Yes, our patients are more than just a physical body. There are emotions that underlie them. They have energetic forces that are within them, that drive them, that build them up or pull them down. They actually do have electrical impulses in their body through their nervous system. And so I look forward to the next tea time and talking to you about the vagal nerve and how I use that to help my patients to really move and to really embrace their body and their movement, and embrace everything about them, including not just the physical extremities, but the organs within the body, and how we can enhance those and facilitate those to help people to accomplish the tasks that they need to accomplish to be able to discharge to home safely. All right, let's move on into our next segment. I see you. I had an opportunity this weekend to provide biofield tuning for a massage therapist, a new friend. And afterwards, I was able to observe two awesome young women, an occupational therapist and a massage therapist, practice their Reiki energy work and receive feedback from me and on what a great job they were doing, and they were very receptive, and I'm excited to see them incorporating their energy work into their professions. Keep an eye out for them. An occupational therapist, a massage therapist, and there's so many more that are getting on board and recognizing the benefit of blending energy work into their professions and what they're doing. Now, I'm going to let Marissa introduce herself to you and tell you why she decided to take a Renergy course this weekend and how she's using Renergy.
My name is Marissa Morrow. I am a licensed massage therapist and the owner of Zen Life Massage. I heard about Reiki 17 years ago, right before I became a massage therapist. I have an aunt who is a Reiki practitioner, so she is the one who really planted the seed, but I just didn't have any interest in it at that time. Fast forward to 2 years ago, and I started receiving Reiki myself and recognized how it was a catalyst for healing in sessions with my massage therapist. After much encouragement from her, I decided to pursue it myself as well. So my clients can also receive the healing. Reiki is non-invasive, so most of my clients don't even realize when I'm doing it on them. I'm able to weave it into their massage for a boost in healing, if you will. For instance, I have a client who was complaining about a pain in her neck. So I palpated the area, compared it to the other side, and in fact, it was very inflamed. I performed Reiki on that area and then continued to massage, and the muscle completely relaxed, and her pain was non-existent after that. Pretty incredible.
Well done, Marissa. All right, guys, that's a wrap. Remember, set your intentions this week. And don't forget, as our patients heal, so does the world. See you next week.